I'm Dr. Nathaniel Chin, and you're listening to Dementia Matters, a podcast about Alzheimer's disease. Dementia Matters is a production of the Wisconsin Alzheimer's Disease Research Center. Our goal is to educate listeners on the latest news in Alzheimer's disease research and caregiver strategies. Thanks for joining us. Welcome back to Dementia Matters. Today I'm joined by Dr. David Rakel, professor and chair of the University of Wisconsin Department of Family Medicine and Community Health. He's also the founder of the Osher Center for Integrative Health at UW-Madison and a recipient of the Gold Foundation's Leonard Toe Humanism in Medicine Award, the school's highest honor for excellence and compassion in care. Today, Dr. Rakel will be talking about his work in integrative medicine, as well as give a preview of his upcoming talk for the Wisconsin ADRC's Healthy Living with Mild Cognitive Impairment series, happening on March 14th, 2025. Dr. Rakel, welcome to Dementia Matters.
Thank you, Nate. Good to be with you.
So to start, and I will let the audience know, I did get a sneak peek of your presentation, and we're very excited to be having you on the series. What exactly is salutogenesis? You're going to talk about it in the series. And how does it relate to integrative care? What does it actually involve?
Yeah, thanks for asking. Integrative medicine initially came from the need to incorporate other aspects of health and healing into traditional models of care. So that was more of an integration of the best science possible for the challenges that we're facing. But it doesn't really have a goal or an outcome towards it. So what we want to do is use salutogenic science, salute, health, genesis, origins of, to have that as our goal. So if we have a population of people and we have a salutogenic science, that science will inform how that population can be as healthy and happy as possible and stay out of the hospital on the fewest number of medications needed to maintain and honor the self-healing capacity of every living being, particularly humans, is our main focus within dynamic environments in which we all live. So integrative medicine is the integration of things like nutrition and acupuncture. Salutogenic science is the science that brings us to a healthier place together, which is different than pathogenesis. Pathos, to suffer; genesis, the origins of suffering. Most of our medical education is in that, is disease and suffering. And that's not the outcome we want. We want to be good at it. We want to keep finding cure for dementia and all the different causes of it. But we need a better balance between the two. And so we need to, right now we have about a 90% balance towards pathogenesis. I would say we need at least a 50-50 balance towards salutogenesis and pathogenesis. So it's a tough word. It doesn't roll off the tongue, but salute is health in Italian, salud is health in Spanish. And if you toast somebody, if I'm going to toast Nate, I'm going to say salud, because to your health, Nate, I want you to be healthy.
That is okay. Thank you. That actually makes a lot more sense now, especially the way you ended it. And frankly, you're just saying there's a balance. We need to be experts in living well, in health promotion, as well as when disease occurs and how to handle pathogenesis. And frankly, pathogenesis is a complicated word too. It's just that we've used it so often that it's become common to us.
Yes.
So you're introducing a very important word, and hopefully it'll become more common to us as we go forward. You did mention integrative medicine, and you've explained that. And I think for our listeners, can you also explain how integrative medicine is different and similar to other terms that people might hear in the community, like alternative medicine and complementary medicine? How do they overlap, and how are they different?
Sure. I'll give you a little history lesson. The initial word that was used for this was holistic medicine. And I think that's a good word. It really shows how everything is interconnected. And then there was complementary and alternative medicine, which is not a great word. Complementary suggests that it doesn't stand on its own 2 feet. Whereas like if we're dealing with metabolic syndrome, nutrition can stand very well. And that at one time was considered complementary or alternative therapy. Alternative is not a good word either, because we don't want to replace something that has good science with something else. We want to use both together. We want to use the best science possible. And I always quote Sir William Osler. He said, "This is an art based in science." And the art comes from going into the context of unique human beings. And what guides our choices is that relationship with that other human being. and then science guides the best therapy possible based on the dialogue, which means meaning running through two people, dialogue. Uh, that information and context is guided by science, but it's really that relationship and the unique aspect of that human being. So CAM has kind of gone out of favor, and then integrative medicine came in. Now there's functional medicine. Functional medicine talks about getting at the root cause at the very early onset of disease, and how do we bypass that or reverse it. Really, I think where this is going is salutogenic science, or really the how complex systems heal, health and healing. That's really the goal that we want. And it's a different financial goal. And this is where value-based care comes, where we get paid to keep people out of the hospital instead of just being paid to treat people in the hospital. So it's a balance. We want both. We want the best specialists possible for when people need them. And we also need primary care interprofessionals working together in communities to keep people healthy. And so they need less things.
And so, with that in mind, then, how can integrative medicine help people who are experiencing memory changes, or for those who have crossed that threshold and now they have a diagnosis of mild cognitive impairment or dementia?
Yeah. And this is a lot of what we'll talk about on the 14th, I think it is we wish we had a silver bullet for dementia. We don't. So what works best now in 2025 is silver buckshot. And we need to use multiple synergistic therapies together to have the biggest impact. So that's where this integrative salutogenic approach goes, is how do we stack the deck in favor of the best possible outcome? Ideally, that would be prevention. But next, it's how can we maybe reverse the disease if possible? And then next is how do we reduce the speed of progression? And then how do we enhance quality of life? That's always the goal.
And so, what is your approach to nutrition and then dementia risk? And I start with this, of course, because of this investment in salutogenesis, and I think food is really really important, as our listeners know. And so, in your answer, I'm hoping you can cover some about alcohol, ultra processed foods, even a little bit about red meat, and my personal favorite, or at least I should say, what I ask my patients to get rid of: soda.
Soda, yeah, good. Those are all, we could spend hours on all of those. But let me just simplify it as much as possible. You could avoid reading all the nutrition books in the world with this, and it's a paraphrase off of Michael Pollan. Eat multicolored whole foods that were recently alive with people you love. So why do I say that? Multicolored whole foods, we have a multivitamin, and it's called plants. And the different colored plants give us the nutrients that we need to be healthy. That has fiber. Fiber slows down the absorption of sugar, establishes a healthy environment for our microbiome. And then eat with people we love. We digest food when we're more relaxed. When we stress eat, that increases the sympathetic tone and actually shunts blood away from our digestive system. And then we have the social support with that, right? There are so many things around that help. But if we just look at the evidence, there's been grade A, top tier level evidence showing that a plant forward Mediterranean DASH type diet, those two combined are considered the MIND diet, where we take the benefits of a low salt DASH diet that lowers blood pressure and a Mediterranean diet that's rich in fiber, whole grains, plants, fish, olive oil, and it's low in the three most inflammatory foods, which is sugar, excess sugar, red meat, and excessive dairy. And then I'd add processed foods in there. Processed meat is probably the worst. But let's go to soda, because there's a whole array of concerns with non-nutritive sweeteners, which soda often has. So let's put the high sugar soda over there. But I will give you this data point. Most naturally sweetened sodas have 35 grams of added sugar. 1 teaspoon equals 5 grams. So that's 7 teaspoons of sugar in one soda that's naturally sweetened. Now let's look at some of the science that's evolving for non-nutritive sweeteners. Aspartame, for example, actually breaks down the blood-brain barrier. And we really need that part of our brain to work well to separate the blood system from the brain system. and aspartame gets converted to formaldehyde, and formaldehyde starts to deteriorate that really important barrier between our blood and our brain. So we're also learning that a lot of these non-nutritive sweeteners have erythritol in them. Erythritol increases thrombotic risk and increases the risk of stroke. And we'll share some research at our conference about the higher risk of stroke and degenerative brain disease with a lot of heavy use. I'm going to say this: heavy use, not light use, but heavy use of non-nutritive sweeteners. And these are being put in all aspects of our nutrition now, not only sodas, but also processed foods.
Well, in your answer, you were very careful to use the word excessive, excessive red meat, excessive certain foods. Are you implying though that, just, and this is really what the Mind Diet does say, to some degree, one serving a week of red meat, or that to some, it's okay to have some, just not a lot. Is that what you're saying as well?
Yes, very much so. Moderation is the key. I love to have a really good steak once in a while, but I don't have one even 3 times a week, right? And that's probably too much. And then the processed meat are injected with nitrous amines. So nitrous amines, nitrates dilate our blood vessels, but amines, when we combine amine with nitrous, it's oncogenic, and it significantly increases the risk of many cancers. But the reason we inject processed meats with nitrates is that they dilate the blood vessels, so you retain more hemoglobin, so it maintains a little pink color when we eat it, and it doesn't look like the cadavers that we had in medical school, right? It's just not very appetizing. So there's a lot of these chemicals that are injected into processed foods that we're learning has a lot of danger to it.
And I'm not expecting you to give us a long answer on this, but the field in alcohol use is really evolving, especially coming from the UK Biobank, showing that any alcohol is not necessarily good for us. It just depends on the outcome you're looking at, whether it's cognition or cancer. Do you have a particular thought when you talk to your patients who are drinking, even if it is a moderate amount?
Absolutely. And you mentioned the UK Biobank, which actually we're going to go over a little summary of all the evidence from the UK Biobank that has come out. And it's the largest number of MRIs of any study. I think there's like 800 and some MRIs where they followed people over time. And this is in the United Kingdom, and they like to have their pints of beer in the United Kingdom. And the key was that the significant loss of gray matter volume really hit a tipping point after about 1 pint of beer or 8 grams of alcohol, which is about one mixed drink a day. So the mantra I like to tell people is have a pint with your friends and then go home, because you'll get the social support from your friends, and then you will have a little less alcohol. That is the tipping point for atrophy of the brain. But remember, the American Cancer Association now, for cancer reduction, no alcohol. That's the recommendation. For heart disease, a little is okay. Maybe for the brain, who knows? But too much is actually concerning for increasing the gray matter loss of the brain.
And so, in addition to food, there is the timing of food. And I know you'll speak to this on March 14th. But what do you think of intermittent fasting or time restricted eating, however you want to phrase it?
Yeah, I think the more politically correct term, as you mentioned, is time restricted eating, but it's the same thing, intermittent fasting. And this is the oldest therapy known to humans, right? We've been recommending fasting for thousands of years. And now we have some good science to back it up. And the main thing for loss of brain matter is that when we fast, we stimulate ketogenesis, which is really good at treating diabetes and helping maintain weight. But that ketogenesis also stimulates this brain neurotrophic factor, that is the protein that stimulates the growth of the brain. So, really promising evidence for calorie restriction, intermittent fasting, time restricted eating, the minimal amount. And also, this is easier than a ketogenic diet, right? It's easier to say, okay, I need at least 12 hours of not eating to have a benefit. The ideal is 16 hours, but at least 12 hours. I can do that every night from 7 p.m. to 7 a.m. I cannot eat. And the benefit there is the eating at before bed. Because if I eat a bunch before bed, it goes right to storage because I'm just going to lie there for the next 7 or 8 hours. So we really reduce that eating in that downtime before bed. So that's a really important time frame to avoid eating. But even better is if you can extend that to 16 hours. And that's where the evidence really shows benefit. So you just reduce your eating time to 8 hours in a day, which people can do generally. And if you want to take one day off a week just to not do it, that's fine. But the evidence seems to accumulate over time for time restricted eating.
And what is the role of supplements? And so when you're in the clinic, how do you approach patients who either ask about them or you find that they're taking many of them?
Yeah, it's a challenge. I think where maybe this field of integrative medicine and functional medicine has not really helped much is in Western medicine we prescribe a lot of drugs, right? In integrative medicine, functional medicine, the supplement is the drug, and it's not really helping us get to a better place together. So that's why nutrition I think is so important. If we're really eating well, we don't need many supplements. And we also want to look at how some of these nutrients might help with dementia or help reduce the risk of dementia. So the key is, why are we taking that supplement? What's the evidence behind it? Why do you feel it's helpful? Let's take Prevagen, for example. I said, I saw so many commercials for Prevagen. There must be some science behind Prevagen. I did a PubMed search. There's very little, almost no evidence. But what does the marketing do? It tells the power of story. And even if there's no science behind it, there's a market behind it. I almost feel bad saying this because someone might be benefiting from Prevagen. And just me saying that there's no science showing benefit actually might reduce its effect. So we have to really understand why we're doing it. I think there are some key ones, essential fatty acids. The brain uses DHA. All fish oil is a combination of DHA and EPA. Breast milk is full of DHA because it's structural. EPA is more functional. EPA reduces inflammation. So we want both of those things for the brain health. We don't have really good data to say taking so much fish oil helps down the road, but there's other benefits of incorporating these essential fatty acids in regards to, again, mixed evidence, but heart disease and other things. That's one that I won't take people off. And maybe we are having a benefit at reducing inflammation. Improving metabolic dysfunction. There's a term that type 3 diabetes is now diabetes of the brain, and we're starting to correlate how higher risk someone is for dementia when they have type 2 diabetes because of this inflammation of the brain and how that can deteriorate that blood-brain barrier. So keeping diabetes under good control is one of the best things that we can do. Blood pressure management is one of the best things. So if there's supplements that help us do that, great. I have some people coming in with polypharmacy, I call it poly supplements, and why are you taking that? And so that's my main question. A lot of times after we go through the list, we can often remove quite a few and really focus more on the nutrition. But people need hope, right? They need something that gives them some control over the outcome of their health. And we want to stack the deck in that favor.
I think that's a really good point too, though, that people want hope and they want to try whatever they can. I always remind patients that supplements are not FDA regulated, and so you have to be careful of what you are putting in your body because no one is really checking what's in that tablet or that capsule in a supplement.
I always follow, I get a little cynical as I get older, but I always follow the money. The DSHEA Act, Dietary Supplements and Health Education Act was supported by Warren Hatch, a senator out of Utah, where the most supplement companies are in the world. So all supplements can say this supports immunity, but it can't say it treats pneumonia. And with that DSHEA Act, we don't really know what the ingredients are because we we do have some stamps on the label, like GMP stamp, good manufacturing processes, means that it was made in a factory that says this is what it is, but it could be sawdust and it could get the GMP stamp. So it doesn't say that this is flavonoids or fish oil. It says what they say is in there, and it was made in a factory that has a good manufacturing process. So buyer beware with these things.
And how do you approach mental health? We know how important mental health is to thinking ability, just the whole body, and specifically anxiety, depression, and stress.
Yeah. Nate, that we have this thing called pseudo dementia that when people get really anxious or stressed, it can actually mimic dementia. Our mind is multitasking and we're stressed and we're depressed. It's hard to form new memory. And so we always want to treat that first. But that's also a really important piece of longevity and function of the brain. One of my things I love to talk about is the science of perception. And really, how you see it makes it matter. So let me break that down. How you see it makes it matter. Isn't it fascinating, Nate, that a non physical perception, I see something in my world, non physical, it comes through my perception, connects to all the wiring that's already in my brain, and that creates a neuropeptide. So out of thin air, we develop a neuropeptide through our eyes that triggers a whole cascade of events that can trigger improvement in immunity, cognitive function, or a worsening of all those things. So how you see it matters and actually makes it matter. It takes all this potential energy and how I see it collapses it into a particle, a neuropeptide. So don't you feel like you want to see things as more loving and optimistic and with gratitude rather than, I mean, in this day and age, it's harder than ever, right? I have to take a news holiday, which is a good strategy, right? Is how do I fill my perception with positive things? And the pro-social emotions are gratitude, compassion, and awe. It's hard to be focused on your own ego when you're in those three states. So how do we enhance that perception of those positive, non-egocentric emotions to bring us closer together as a community? And that all starts with how you see it. And that's such an important thing to learn. The earlier we can treat that to or teach that to our kids, the better.
Well, that really fits into my next question, which is the role of gratitude or optimism and even the sense of purpose. And I think that matters a great deal after a person retires. And we see this, of course, in the field of geriatrics. People can lose a sense of purpose. And so, how do you approach individuals with mental health questions or just stress in general? And how do you incorporate that? How do you explain to someone, well, we need to bring in more gratitude or optimism or purpose?
First thing, Nate, I think is the questions we ask people. And you mentioned going into retirement and when people lose that purpose, actually their risk of premature death goes up 2.5 times when we don't have something to wake up in the morning to live for. And so when we were asked to come into the VA, the largest health system in America, the Veterans Health Association, and change the conversation from what's wrong with you to what's right with you. And that alone, if I look at Nate and say, boy, Nate, you've got this tremendous ability, you're dealing with this challenging condition, but how do we pull the health out of you as much as possible? And then I have to ask you a different question. And the question that we asked was, what do you want your health for? Why do you want to be healthy? Because health generally, if we catch it early enough, is much more about what we do than what we take. By far, the evidence is so much more powerful for healthy behaviors rather than the Aricept that we use to treat the dementia once it occurs. So if we can really work as far upstream and really ask people, why do you want to eat better? Why do you want to forgive your neighbor? Why do you want to go exercise your mind and your body? I'm not going to be the one making those choices. You are. So how do we create an environment where you can be successful, and what do you need? So it's really, this whole salutogenic science is really going into the patient's goals and not our goals. So often in Western healthcare, you need what I know, right? And that's a dangerous projection that often people don't want to hear. So how do we get into that dialogue of what do you need and how can my expertise help you achieve it?
That's fascinating, Dave. And so to end today, I always like to ask a personal question. And so, what's the most important brain health practice you're engaging in right now? And I recognize it can always change depending on the time. And what's one activity you're also working to improve?
I'll start with that latest one. What I want to grow. One of my favorite mantras, Nate, is that to which you give attention grows. If I want to build up my bicep, I got to do the curls, right? I have two grandchildren, Leo, who is 6 months, and Willa, who's 19 months now. That's what I want to give attention to. And it gives me a joy, and I see them, the funny things they do, and the non-politically correct things they say. And it's so much fun just being with them. And when we do reminiscence therapy with people with depression, I love doing that, where we go back into a time where they really had meaningful memories, and it's usually in the distant past. And I say, tell me about that book you wrote when you were 30. And they tell me about it, and their recollection is really good. How can if I develop dementia down the road, I want to make sure that I'm investing in those things that are most meaningful to me. And at this time in my life, they're my grandkids, my kids, and my wife, and everybody else as well. But that's what I'm trying to do, and do all the other things, exercise. And I like to ride my bike, and I love to. And I grew up in Iowa, right? Meat and potatoes was everything that we ate. But after you start to actually change your nutrition, you start to crave it, and it takes about 6 months. So that just be patient with yourself, but you have to actually start to choose those different foods. So, anyways, thanks for asking. How about you, Nate? What are you doing?
I think sleep is incredibly important because it allows me to do the other things, and I have two little ones, and so I don't get a lot of sleep. So I put a lot of my attention to trying to create good sleep hygiene and wake up at the right time and go to bed early enough. And so that's what I work on, and then I like to exercise. It's a good way of de-stressing for me. So thank you for asking, Dave. I appreciate that.
That sleep, that circadian rhythm is so important. And when your kids were young, I bet even if you wanted to, you couldn't. So
Absolutely right. Well, with that, Dave, I'd like to thank you for being on this podcast. And for those listening, I'm really excited to have you March 14th on the Healthy Living with Mild Cognitive Impairment. For those listening, if you want to hear more from Dr. Rakel about integrative medicine, how it can benefit brain health, the tools to encourage motivation on your personalized pathway to wellness, please join us for the first Healthy Living with Mild Cognitive Impairment education program of 2025. This is a quarterly series. It will take place on Friday, March 14th from 9:30 to 11:30 Central Time, both virtually over Zoom. And we do have 8 community host sites across Wisconsin. So find out more details and information on how to register at adrc.wis.edu /MCI. And thanks again, Dave.
Thanks, Nate. I enjoyed talking with you.
Thank you for listening to Dementia Matters. Follow us on Apple Podcasts, Spotify, or wherever you listen, or tell your smart speaker to play the Dementia Matters podcast. Please rate us on your favorite podcast app. It helps other people find our show and lets us know how we're doing. If you enjoy our show and want to support our work, consider making a gift to the Dementia Matters Fund through the UW Initiative to End Alzheimer's. All donations go toward outreach and production. Donate at the link in the description. Dementia Matters is brought to you by the Wisconsin Alzheimer's Disease Research Center at the University of Wisconsin-Madison. It receives funding from private, university, state, and national sources, including a grant from the National Institutes on Aging for Alzheimer's Disease Research. This episode of Dementia Matters was produced by Amy Lambright Murphy and Kaylin Rowerdink and edited by Eli Gadbury. Our musical jingle is Cases to Rest by Blue Dot Sessions. To learn more about the Wisconsin Alzheimer's Disease Research Center, check out our website at adrc.wisc.edu. That's adrc.wisc.edu. And follow us on Facebook and Twitter. If you have any questions or comments, email us at dementiamatters@medicine.wisc.edu. Thanks for listening.